quadriceps, okay, so that we can then do the hamstrings and the leg in a new video, so that it's not too long. Okay, you see, my good friends. So there's that. Okay. So I'm going to release the sator. Remember, I was saying in the lecture yesterday that the rectus femoris covers a little bit of the vastus intermedius. Okay. So we've already kind of started. Well, we started with the rectus, the vastus lateralis, which is this, which is all this is, that is covered by the tensor fascia lata here. It's really covered by the fascia of the tensor fascia lata, and this is the vastus lateralis. So what I'm going to do right about now is I'm going to work on this line. Do you see this line here? Because then that is the division between the vastus lateralis and the vastus intermedius. Okay, so I work on it like that, okay, just to gain a little bit of access, so that this way I can peel the vastus lateralis, because it partially covers the vastus intermedius. Okay, then you see it. It's nice and round. It's very cylindrical. You see what I'm saying, my good friend? Do you see what I'm saying? So you can even hear the connective tissue. So here, I do that. Here we go. And then we're doing that. Do you see the connective tissue here? Some of it is tough, so you want to make sure you don't rip the muscle with it. Okay, very good. Okay, very good. Now we've peeled off the vastus lateralis from the partial covering of the vastus intermedius. Now we are removing the vastus medialis, because it also partially covers the vastus intermedius in the middle. Okay, my good friends. So there is that. So we're doing that, and and so this connective tissue is a little tough. So I want to just cut a little bit. Okay, very good. So now, do you see here? Look here. Look at this nice round rotund muscle right here. This is the vastus intermedius, and then this is the vastus medialis, sartorius, and it's also here because we cut it. All right, and this is the rectus femoris, okay, and this is the tensor muscle, right, with the fascia, tensor fascia lata, and the fascia of the tensor fascia lata covers the vastus lateralis. Okay, so the quadriceps would be like we talked about yesterday when we were talking about the sciatic nerve and the obturator for femoral nerves and stuff like that. So this is the rectus femoris 1, and then this is the vastus lateralis 2, and then this is the vastus intermedius 3, and then this is vastus medialis 4 of the quadriceps. All right, and then obviously the sartorius is also on the anterior thigh. Sartorius. All right. Over here you will have like the pectineus and so forth, but this is nice femoral vein right there, which runs with the femoral artery. Okay, and then this is one of the proximal quadrifemoral artery and vein. So you know what I'm gonna do? So since we've done the hip and the butt and the quadriceps for the most part, and then obviously this quadrifemoralis dash dash dash. So again, this is the gluteus maximus, and you can see the line here. So this will be the gluteus medius, then the tensor fascia lata, then the rectus femoris over here, and then quadrifemoralis dash dash dash, and then of course rectus femoris over here, and then this is the vastus lateralis. Okay, we flip it a little bit, and then you have the vastus intermedius, and then the vastus medialis, and then sartorius, right? And that's it.